The first round of grants went out today. They went to organizations working in healthcare, mental health, and substance use, especially in communities that experts say have long been neglected. Now, the Richmond Henrico Health District is helping to administer this fund and manage it, but its potential impact goes well beyond an office building like this one when you head actually into the communities to see where the work will be done.
This is where my family was raised.
Standing in Wickham Court, Sheba Williams reflects on the generations of her family who grew up here and how her work now can address some long-standing problems.
Substance use has impacted our family ever since I can remember. My parents were incarcerated at the age of 10 because when they suffered from substance use disorder, incarceration was the answer. Right now, the solution is the support that we give to people in the community.
Her organization, No Left Turns, helps recently incarcerated people with housing and substance use recovery. One of 3 local organizations to receive money through Richmond's new Health Equity Fund.
And if we really care about the lives of people who are coming out of incarceration, the people who are in our recovery community, then we know that we have to continue funding these efforts to make sure that their lives are saved.
This is the kind of investment we must make to establish health equity for our most vulnerable communities.
Richmond's Health Equity Fund is the first of its kind in the Commonwealth and only the 3rd in the nation. Experts say economically disadvantaged communities and people of color face worse health outcomes in many areas, something the pandemic made even more clear. Richmond is using $5 million in federal COVID relief money to fund grants to community groups, nonprofits, and residents doing work to address health disparities on the ground.
In this moment, this is critical, not just today, not just next year, but ongoing. This is a generational, historical, long-standing. So that's the challenge. But the good news is we've decided to do something about it in the city of Richmond with this Health Equity Fund.
No Left Turn, Crossover Healthcare Ministry, and Richmond Behavioral Health Authority got the first almost $250,000 to help in their work. The remaining $4.6 million must go out by 2026. But since healthcare disparities are generational problems, we asked Richmond leaders what plans they have to see the effort into the future.
I think it's incumbent upon those who are in office today to ensure that this is something that we do all the time. This is what Richmond does. So this can't time out after 26.
We're going to go to our philanthropic partners as well, to whether it's foundation or corporation, for the long term.
Community groups and individuals are nominated to get this grant funding if they're already doing this kind of work or have the potential to do it in the near future. The next round of nominations actually opens up next week. We have a link to that on WTVR.com.